So I guess, Dr. Jett, we got sent the agenda that the same as last week to cover mitigation and quarantine. I'm not sure if there's any updates on those specific issues.
No, there's no update. I can, but nobody can see the slides because everybody is in.
Two of us can. Richard,
So I probably won't show the slides, but I can first give an update. I'll show a brief slide so people have an idea. Devin, can you release control temporarily?
It's Darlene. So this is partially a teaching meeting since this is her first WebEx event. So Darlene, you'll just assign the privileges of presenter to Dr. Jett. You can see that you are the presenter right now because you have the little WebEx logo next to your name.
Okay, so analyst privileges. So am I going to, okay.
Okay. I'm just going to give a quick. I haven't did anything yet, but it asked to share my screen, which is right. Let me share content. So usually it would have, I can share my content, but I'm not finding it up in the share.
I'm wondering, since we've all got limited connectivity to each other, if we should just deal with the immediate issue. Is that all right?
Yep.
All right. So last week we talked about this notion of the town was considering some changes to traffic patterns to widen sidewalks as it was brought to us in order to make it easier for people to be outdoors and do recreation things. And I think there was a general agreement that that was a profoundly bad idea, that we didn't want to do anything that would undercut the message that people should be home except for essential business. Since then, it turns out the select board did approve a measure, and the transportation board has not formally voted, but supported this around what they're calling essential corridors. So I guess there was some anecdotal information that a lot of people are walking or biking to work to the medical, along with medical area, along Longwood and Brookline Avenues. In addition, that a lot of people are trying to get to pharmacies and supermarkets, includes Corner, parts of Harvard Street. And here it's quite impossible for people to do those essential things while distancing because of the narrowness of the sidewalks and some of the volume of traffic. The select board approved a measure that is indeed expanding those areas for foot traffic, again, explicitly for the purpose of essential services, both getting to medical facilities and getting to pharmacies and grocery stores. They voted down 3-2 on two proposals that had to do with recreation. So as things stand now, the things around recreation don't stand. I guess what I have heard from Chris Dempsey of the Transportation Board called me up because people have heard that the Public Health Advisory Council disapproves of any transportation measure. And he asked me if we could clarify our position around the essential services. I've spoken with Dr. Jett, who has brought up the concerns that they're not doing any measurement of actually who is using these corridors, and that clearly there are people who are using those corridors for things other than essential services. That said, I guess I did promise him that I would get back to him, whether we come up with a point of view or not. Be interested in hearing what other people have to say, or if there are questions directed to us.
This is Peter, Tony. I heard your comment about other people are using it other than for essential services, and it's not being monitored. So are we going to try to monitor it? Are there police around who would remind you in a friendly way where you're going, or is it just up to the citizen to decide, or what? Do we know?
Well, that's a great question. I guess what Dr. Jett told me is that he doesn't think the town has done anything to do any kind of formal monitoring.
Uh-huh. Well,
Again, Dr. Jett, I don't know if you want to comment on that.
Yeah, so things that should occur, because, I'm very cognitive of us continuing to have this conversation while in other communities, people are dying. So I keep that at the forefront. And we really urging people to stay at home. So let's say you open up a corridor. My thought is, what's the difference now between 3 months from now? And we have no data. So if usually you do some type of walkability study, and you look at walkability measures. That's something that the transportation department can do. And I'm sure that the bicycle commission has done, but we should be looking at how many people access the streets, how many workers are on the street versus leisure, how much vehicle traffic, how much bicycle traffic, how many runners, what are the peak times of usage. Right now, we're making a decision again, not based on data and not based on any type of formal study as to say, as to reason why and how much is it used. Is it used, are there certain times of the day that it should be open for that particular corridor? And then how is it going to be measured? Who's going to monitor that or enforce that? Because at this time, no matter if you look at opening up Coolidge Corner or any other part of Brookline, there's a lot of people on the street that's not essential, doing non-essential tasks. And it's not always going to Trader Joe's or to the pharmacy or going to work.
Right.
We can't surely make the argument of people going to work in that corridor from 8 to 5 and all the times in between. So I think there needs to be a little bit more information provided to make a good, educated, rational decision. And I don't think we have enough data, or at least not enough study to do it. And we do it for traffic studies. And I'm sure we have done walkability studies before we expanded something.
Yeah.
so where are we at? Has the town okayed it already? The board of people's okayed it already? So maybe we should, a beginning to me would be at least education, signage along those routes saying this is really for essential stuff only essential personnel only during those hours, whatever. Signage is a good start. I mean, if I were stopped, I would probably not know that I shouldn't have, I don't know. I think we should have signage so people know at least.
We got signs around the parks, around the playgrounds. We have signs everywhere. People still use them.
They do?
We still get a lot of complaints surrounded that. That part of what's taking up a lot of my time is responding to all the various emails, whether it's public ways,
Gotcha.
it's dealing with playgrounds, somebody smoking in an apartment complex. When, really what's essential to me right now is the contact tracing, isolation, and quarantine, and preventing death.
All right, so I gotta say, I see this totally differently. I mean, we are told to stay at home, and we want that message clear. we're also, I think, understanding that there are essential services that people have to get out for. Groceries, drugstores, health, people who have essential jobs getting to work. I don't think anything we say or even what the town does around widening sidewalks around essential services changes the fact that people are going to abuse that. The issue for me is messaging, that if we were to open these up around recreation areas, then we're contradicting the critical public health message. I think if we're opening up around places like Trader Joe's along the Longwood where there are essential people walking to work, it's going to allow those people to do those essential services perhaps with more safety. Sure, it's wonderful to have data and do a study. When do we get that? 3 weeks from now. But people have to go to the Longwood medical area tomorrow. People are going to buy groceries tomorrow. So I guess I'm not seeing. First of all, I just think there's a huge difference between the two.
Anyway, I'll put in my 2 cents. This is David, and I completely agree with Tony about this one. And also Peter's notion of make sure there's signage. So if when things have changed, that people really understand why they've changed.
Yeah.
So what are we saying? The decision's been made. It's how we try to implement it, right? What we do with the decision.
Well, there's a possibility it will be reversed. I mean, there are people who are, as I understand it, are trying to reverse it, basically saying that the advisory council has recommended against any actions to expand pedestrian areas, whether for essential services or for recreation.
Right.
They probably, quite honestly, won't reverse it, even if we say we want them to, but it's creating a lot of conflict within the town. And remember, we're also, I mean, we're advisory to Dr. Jett, we're also, who ultimately, as health commissioner, gets to make final decisions around enforceable public health decisions. But we're also Brookline, where what we see as a council is going to have public currency, whether we want it to or not. It'd be nice to have a united voice. You know, if that united voice is essentially that there's divided opinion about this one, at least we can be clear that there's divided opinion. I do hope everyone speaks to this.
Well, Swanee, let me hear your thought. I think I get what you're saying. You're saying if we open it up, it's going to be used by everybody. This could be going on for the next several months. We'll never be able to close it down again, which is probably true. I think is that what you're saying? Is that what you're saying?
Thought is, number one, I'm not so in my world, and I understand the optic of political pressure, people calling everybody, just like we dealt with Warrant Article 19 on tobacco.
Yeah.
You know, I only can stick with the evidence. And so I make public health decisions based on evidence. I can't make a public health decision based on anecdotal data. And, you know, if they want to open up a corridor, this could have been done well before COVID-19. But right now, we're in the middle of a crisis. So we don't have any data to say, right now, it's not even being monitored that everybody should wear a mask in stores. It's not being monitored to keep people off the street that are doing non-essential items. So we already have evidence that's not occurring because there's nobody there to enforce it. So who's going to be there to enforce that we open up a corridor on Coolidge Corner or Brookline Ave to ensure that it's only for essential personnel? There isn't.
But how does that
I can't
change?
guarantee you that it happen eventually, just by people being out and about, is that the health department will get more cases and we'll be doing more contact tracing and isolation. And that is one thing that will happen from a policy that impacts public health.
Yeah.
When you say
I'm gonna,
eventual contact tracing, so what was your comment there? What are the implications for eventual contact?
Implications, if we have more people in the streets out and about for non-essential items, that's more opportunity for people to be exposed to COVID-19.
More contacts.
And the health department will be doing more contact tracing.
I get you.
but here's what I don't understand about your point. How does having the wider corridor only in those places where there are indeed essential services and there are crowds because of those essential services, even though it's not everybody, how does widening those corridors mean that there will be more people transmitting the disease?
But I guess what? I know one thing we would know. If you open it up, we'll see more people out, and then we'll find out. Because public policy and the documents you sent, you know, if public policy holds true, the reason people expand walkability, do walkability studies, is for more people to be out in the area. They don't expand to restrict it. They expand to make sure more people out. If you expand it, more people would be out. That's why they do walkability studies.
But those are the people where there are people going in and out of grocery stores. So I guess for me, let's say, so I just want to go to Trader Joe's because I need milk, right? So I understand that there are people there who are walking on the streets for recreational purposes who shouldn't be there. But doesn't it protect me if those areas are a little bit wider? I mean, you're saying we don't have data, but we do know those are where the people are going who have to perform essential services. And I guess, and I'm not sure if when the only areas that are being widened are those which are intended for essential services, if that's really going to give the kind of message that's going to pull more people out on the street. Yes, we can certainly recommend we measure it going forward. But as of right now, what is clear is that when I go to Trader Joe's, I can't even get in without being surrounded by people because the access ways are narrow.
Do you think there'd be more or less people in there if you widen the sidewalk?
The whole purpose of widening the sidewalk is for people to have more space and more room, so there'll be more people. If you open it up, there will be more people. I don't know how we can dodge that point right there.
I don't know if
we do
know for sure.
walkability studies for people to be out. There's never been a case you widen the road that more cars don't be out on the street.
All right. Did Gretchen have, was that, did you want to say?
It's Gretchen. So I was just going to say, like, I don't know if expanding the street will ensure that more people are there. I think if we are clear in our messaging and encouraging people to stay home and only go out for essential services and needs, then I don't necessarily think that allowing more space will then cause more people. I think people, if we encourage our messaging and keep it up, maybe we have more signage around sidewalk use. I agree that when I've had to go to Trader Joe's, I felt like some of the people on the sidewalk were too close to me. So, yeah, I don't know. I'm not worried about creating more space. Doesn't necessarily mean more people will be there.
No, I mean, again, I think if we did it at recreational areas, if we didn't, but again, they're doing the 2 blocks of Coolidge Corner from Pleasant Street to Center Street. Right? So it's not the whole boulevard of Beacon Street. So I do think you're right that in general, if when you build more highways, yes, you get more cars and more congestion. But if you're opening up only the areas where congestion already exists, where we know at least some of the people there are trying to do the right thing and just take care of essential services, by the time we wait for data, will be irrelevant. It just seems to me there's an argument to be made that you're doing more for safety than you're pulling extra people into the street. The people out there recreating, they're out there already. I don't, and I agree. If we explicitly opened up recreation areas, that would invite more people out.
So I guess this is Gretchen again. What is kind of the goal we're trying to reach in this conversation?
Well, again, we've been asked by the head of the transportation board to weigh in on how we see the issue of the expansions of corridors where essential services exist. We stated last week that we were against doing it in recreational areas. We did not know last week that there was a distinction being made in the proposals that went to the select board and the transportation board. So I think we're trying to clarify our take on this explicitly as it relates to these what are being called like essential service corridors. I think what we're hearing is Dr. Jett is strongly against. I think I am personally in favor. I've heard a couple of other people express some sentiment in favor.
I'm
I
mixed.
think that's what
I'm mixed. It would be hard to enforce it. I think we all have to recognize that.
yes.
I hate, in some ways in life, I hate to make rules and knowing that people aren't going to pay attention to them. It isn't good to me. I don't know. It's not good parenting to make a rule that you're not going to follow up with. So, but I also defer to Swanee's comments. I mean, you've got to deal with a lot of the political pressure, and it's nice to have some data. I thought, should somebody go out there, Swanee? Should you send someone out to Woolwich Corner, for instance, and get a sense of exactly, of the traffic? I don't know how you measure. Is it that complicated that should take 3 weeks? Could you do it in a day?
I think, one, we continue to pass policies and we don't know the impact.
Mm-hmm.
We do it off anecdotal data. And to me, that's not a rational way to go about this. To me, do a walkability study. And I think that's something the transportation department should want to do, since this has been an issue long before COVID-19. Now, the one thing I always have an issue with is that some of these corridors have been on the blotter for a while in terms of issues. I mean, Tony, you probably wasn't aware of it, but it's been out there to make changes. Now this is a gateway to make change because it's COVID-19.
Right.
So they use the public health to do this, which I have no problem with. But I think we need to know, first of all, how many people use it, as I said, what's the peak times people use it. We need to be able to differentiate between what is actually leisure and what is required, what is essential. I don't want people having more access to walkability and increase the amount of COVID-19 cases we have. And there is probability that can happen. So I think in order to make a good rational decision, I don't see anything wrong with having some type of walkability measures put in place to be able to monitor before, and to be able to monitor after. So if you do decide, hey, it might be good to open up these corridors, we can understand the impact of that. I don't think COVID-19 is going to be gone in June. I do believe there might be a resurgence in September. So we'll have something to go by.
This is David. I have a question, which is, in terms of changing the width, is this very inexpensive? Is this easily reversible? Can this be done in the day? Or are we talking about major changes in curbs and things? What are we talking? Are we just putting in little barriers that make the roads a little more narrow and those sidewalks a little wider where you're walking in part on the roads? Because that matters a lot to me. If it's just a very easy thing that can be easily reversed, we ought to do it, I think. If you're talking about major changes in construction and curbage where now we're stuck with this forever, that may be very different.
This is just being done with cones and directional signals and signage. So basically they're taking lanes of traffic away and using cones so that people can be out on the parking lane of the street. The first traffic lane is now the parking lane. And so on Beacon Street, there's now only going to be one lane of traffic between Center Street and Pleasant Street. So this is all done as temporary stuff. You know,
So then I'm very much for it.
How long does it take to put up to get the signage ready? What is the time lapse for? Is that a couple of days or a week or two?
So I think I think it's already up. I think it's already been done.
Oh.
But Dr. Guys, you might know differently. The select board voted on this last week,
I see.
but I've not been out to those areas.
Swanee, we should, if this is proceeding either way, shouldn't we do whatever it's called, walkability study, have it conducted? I hope it's not a 3-week study, but if it's already proceeded, still makes sense to me to look at a particular spot, be it Coolidge Corner, and see whether this kind of, well, for instance, should it be made permitted or should the idea be put to rest?
I think the transportation.
Get them to do it. Yeah.
I think it's something that they need to do. I don't like short-term fixes. It's something that needs to be done. It should have been done before COVID-19 occurred.
Except that this is only about COVID-19. That's what I don't understand.
No, that's not the case. This has been out there now for discussion long before now. This has been used now because COVID-19 has occurred. And this is not the first time it has occurred. Every time there's a big hot topic issue, public health is usually the window that people use in order to get something passed through. And then if ACPH decides to vote one way against something, the political pressure, people pick up the phone, they call, they ask us to reconsider, change our vote. So this is not the first time it has happened.
Okay, but listen, but I'm a little ticked because we did not, we're not being asked to change our vote. What you presented to us last week was this was about recreation. So we didn't hear this last week. So that put us in the position of taking a vote that was about something other than what was being discussed. So perhaps I misunderstood, but I heard the conversation when we made this decision last week was purely about recreational areas. It was about something different. Now, if what you're saying is that these notions of widening walking space for Longwood and the 2 blocks of Beacon Street have been on the table before, that's also new to me and was not explained to me. So, it seems like on all sides we're being asked to make decisions with limited or inaccurate information. So it's hard to use our judgment in that circumstance.
Last week, actually the week before, there was information about the transportation board, what the intent was.
But that was not presented to us.
It was sent to you.
No, it may have been. It certainly was not brought up in the meeting. I'm getting 200 emails a day, and my attention was not called to that.
And it was about public ways, not recreation.
What do you mean? That was the title?
Yeah, public ways.
Was it sent to the whole advisory committee or just to Tony?
I have to go back through and check the emails.
I'm almost positive I didn't receive that.
Yeah. And as far as I know, I did not see anything until Wednesday night when I was listening in on the transportation board's meeting.
Yeah, so it came through all the feedback from different town meeting people. You got it last Wednesday.
Right, that was 2 days after we had an all conversation about recreation.
So that was the first one I could find.
All right.
I think Mail sent another one to you. I don't have the copy of that one.
I do not think anything was sent to me before our meeting a week ago, when what was presented to us orally was about recreation.
Is this the best way to proceed at this point? I'm speaking, throwing this in, whatever the history, we got to move forward. You now know this additional stuff, Tony. Does it make a difference, and how do we proceed? You guys should probably have an offline discussion of it, really get into the specifics, right? But I don't want to go.
Well, we can't deliberate except at publicly announced meetings.
Okay.
I don't know how to proceed, quite honestly. Again, this is I mean, we're in an emergency situation, but it feels like a repeat of what happened last year, where we were being asked to make decisions with limited information. You know, my instinct personally is still in favor of the emergency areas being widened. I mean, Dr. Jett feeling strongly against that, but the history is important because we are on record as having been against these, or it's being said that we're on the record as being against those emergency corridors. If I were to move forward now, I at least want to say that we have no opinion or a mixed opinion. And again, Dr. Jett is the commissioner, and he makes the final public health decisions, irrespective of our advice. But I do not want to be making advice with partial information. And now I'm hearing disputed information, because what I was told by Chris Dempsey of the Transportation Board was this was a measure brought up specifically around COVID-19. What Dr. Jett is saying is that this is an old proposal that's being brought forward using COVID-19. So I'm not really sure how I can make a professional judgment or give a professional opinion. So I don't particularly see a constructive way to proceed. If anybody else has one, I'd like to hear it.
I guess a quick question I would have is, after our last meeting, did the advisory council give a particular statement on this? I know you said you might work on a letter, but did that letter happen? Was it sent to someone? I guess I don't know that piece of this puzzle either.
Yes, I believe a letter was sent. I crafted it. Dr. Jett made some edits. I don't know if it's something we can look at now.
Yeah, the letter went to the Transportation Board. Or went to Todd Crane, who shared it with the Transportation Board.
Is that something that you can email us?
Letter?
Yeah.
I guess one other thought that I have, this is Gretchen again, on this is if there is a concern that this, COVID-19 crisis is being used as an opportunity for this particular measure, can we, just request or ask more questions around the time frame? I mean, this is temporary with using cones and signage. I don't know how it would necessarily become a permanent thing without a lot more many other people weighing in over a very long period of time to make those things more permanent. But is there currently a time frame on these temporary measures, or is there a way to get clarification on a time frame?
The Transportation Board is meeting right now. So this issue comes up at 8:15. Everybody more than welcome to join it and ask questions.
I like that.
So you can get those answers in real time. Because they want to hear from ACPH, which it seemed like they would have heard from us before they made a decision. If they wanted us to change our vote.
Well, again, I don't think it's accurate to refer to this as changing our vote. We were given different information than we've been given since then.
Well, they want a reconsideration of deliberation. I mean, however the technical part of it, they brought it back up for us to have another discussion.
I didn't even know that was a specific request from them, or that was part of tonight's meeting.
It wasn't part of tonight's meeting. It wasn't on the agenda.
Right. So who's requesting us to give a technical reconsideration by tonight?
Somebody called Tony and asked for him to do that. From the Transportation Board.
Asked you to do what, Tony, exactly?
He asked me to have the advisory board clarify its position because
on the lanes for essential personnel.
That's right.
Yeah.
Right, so our letter, I just opened at it, was giving consideration to expanding right-of-ways for walkers, joggers, and bikers so they could continue to use outdoor spaces and exercise even during the COVID-19 crisis. And that's what we recommended not be taken.
Right.
Taking affirmative action to make outdoor activity easier, even if in some small ways for greater social distancing, dilutes and may for some even contradict that message.
Yeah.
So I will forward this email to the ACPH right now. It's March 30th, 2020. It came from Todd Crane to myself and Mel. It required other municipalities in the U.S. are taking steps to create larger areas for pedestrian use, either passive or active recreation, community purposes, while maintaining social distance recommendations. Examples of this include closing off residential side streets to non-local traffic, blocking parking or travel lanes adjacent to the parks to allow for additional pedestrian and cyclist space. And you can find examples, and it sends stuff from governor's office, etc. There have been many calls for similar action in Massachusetts, and our office has received several requests. There are listed below. So this starts off, we have discussed internal and believe that this can be done on Pond Ave by making it one way to maintain resident access while dedicating the travel lane adjacent to the park for pedestrian and cyclist use. There are other areas around town adjacent to parks, playgrounds that we believe can take similar measures, but we wanted the input of you and the task force before moving forward any plan at this point. So this has always been in the backdrop.
But I'm sorry, but
direction.
Right.
And so
everything you said, Swani, I got everything you read to us was about bicycling, jogging, parks, one-way streets in residential areas. None of it was about essential services, essential corridors. So that, and what you just read to us is what you read to us last week. That's what we took a vote on, right? We had said nothing about the essential corridors issue, and I personally see them as two very different things around which I have opposite views.
And that's fine. Nobody's disputing your opposite views. I'm fine with you having an opposite view. It doesn't mean I have to go along with the view, though, because I can take the view. I can take the view that, because I don't want to create an opportunity for more people being out, because I think it might create more cases. I mean, I have a right to have that thought process.
Right, I know, but I feel as though we have been put in the position of having been asked about recreation, and then the world was told that this was about essential services as well.
They adding stuff as they go. I don't get all the latest information of what they're doing because, frankly, I'm working on stopping COVID-19.
Yeah.
My job is not to sit up here and worry about public ways. I'm trying to prevent death happening in the community. That's my number one priority. So if they change in dynamics or come up with new information, I'm not trying to keep up with that as much because I don't have time. I'm worried about people at nursing homes, assisted living, and other items.
So Swanee, let me just, your argument comes down to wider space means more people.
Yeah, I just think right now is not the opportunity to move in that direction. I don't have a problem with opening up more space, looking at that in the future. But right now, we're having a conversation, hour and a half, 2 hours long. I still got to call other nursing homes. They're probably more priority. I'm sorry, that's just the way I look at it. We need to have a discussion about opening up corridors. I'm trying to make sure nobody dies. I think something has a little bit higher priority right now. I don't think we need to be having this conversation because to me, it might seem great on surface, but we have other communities struggling with real life issues. And so if the board wants to vote, they want to be for it, I have no problem. I say just make a decision and drive on, and I can concentrate on something else.
All right, can I just ask you, you said earlier that this has been up around town for a long time, but now you just read to us what's been around town for a long time about recreation, or is it about essential corridors?
It's always been the thought to opening up some of the corridors for more walkability, more bicycles, etc. Now, to the extent that I know of that, I don't know. I just know that in previous emails of this conversation, this is nothing new. This didn't just arrive a month ago or 2 weeks ago. This has been something, a long-term plan in order to open up more space.
All right. I guess from what I've heard, I disagree that that was the intent of this essential corridors change. It makes sense to me that people in Brookline have been trying to do this around recreation for a long time. And I would reaffirm our position from last week that that's not something we support during this crisis.
So Todd,
I'm looking for,
this is David. Could we say as the advisory committee that you know, we haven't changed our opinion at all about expanding for recreational uses, but we are not against increasing areas for essential corridors for personal use. We are not against it, and that we think if ever to become permanent, we need much more data and
we could say that. It sounds like we would be doing that knowing that our commissioner is opposed to it. And we have to be thoughtful about that. I mean, I think we could add to, not being opposed is different from being for it, right? And the other thing that we could add is saying that we think it is important that this be monitored, studied, and if it does increase foot traffic of recreational people, it would need to be reversed. That might be some way to put ourselves more, in a little closer to an agreement with our commissioner. Gretchen and Peter, do you want to weigh in on what David suggested?
I missed some. I had to walk away from it for family reasons. But
okay.
Go ahead, David. Give me a summary of it again. I'm sorry.
So I was just saying that we sort of reaffirm what we said last week about recreational usage, but that we are not against temporary changes for essential personnel, and then Tony added correctly, that this should be monitored and we should get huge amounts of better information before we could ever argue that this should be made permanent.
Well, I don't, seems how I really don't know whether a broader corridor would bring in more people and therefore create more problems than we would be beneficial to the essential workers. We should at least report there's mixed views, because I don't know. You know, I don't have any experience in it. So I would defer to somebody because he's going to make the decisions and I can see he wants to move on. So I would say mixed, just to say mixed reactions, or there was some opposition, whatever you want to say, but I want it to.
Yeah, I like the way that Dr. Hemingway phrased it. The only thing that I would maybe leave off is not implying something about a permanent solution. I don't think that ever came up in what they've proposed. So as long as we make sure we're framing our response in terms of specifically the COVID-19 crisis, I think that's important.
All right. There's sort of three, sounds like there's three of us in favor of saying reaffirm against recreational, not against what we're doing it for essential services. We don't have to talk about permanent solution, but say that we assume we see this as temporary and that it needs to be monitored and reversed if problematic. Peter, you would still oppose that?
Which, on the second one about it, yeah, I would say, yes, I'll oppose it because I want people at least to recognize that there's a downside to it. You're going to draw more people into the street. At least I'm looking at it that way.
Okay. Dr. Joe, are you still with us?
Yeah, I'm still here.
Still here. All right.
You could take a vote. That's all right. But it actually, yes, I don't know if it is all right. I heard your comment about not backing Swanee. I don't think that's what we need as a town. So I would say we gave him the advice, but you know, backing his experience. And
do we need to vote though? Can we just maybe clarify or add some additional comments and not necessarily say that we've re-voted on anything? Because I don't necessarily think that that's necessary.
I think that might be the right way to do it. I mean, we could vote, but with one person missing 3-1 and a vote that our commissioner does not agree with, puts us in just a bad position. I would perhaps more say that what we could do is reaffirm our position against recreational, is that there is, there's an understanding that corridors for essential services are different. There is mixed feeling among the advisory committee and a clear need that this be monitored and studied to make sure that if these are widened, it does not increase foot traffic and increase use by recreational users.
yeah, okay,
Okay, me.
That works for me.
me too.
All right. It may not be exactly what you would want us to say, but can you live with us saying that?
Yeah, I can, but I don't think we have any measures in there to make sure that it's enforced. And I just think,
Well,
we'll see what happens.
all right. Well, again, you're right, but we've asked them to do that, and we're not making the situation worse. As it says, it's already in place, and I think our suggestion would be, at least it would call to their attention the point that you and Peter have both made, that this does have a potential negative unintended side effect. Again, among us, we disagree as to whether that's likely to happen or not. But the bottom line, you are right. We don't have the data, and we don't want to be blind forever, even if we're blind now. Let me write something up. I will send it to everybody. If it's okay with everybody, then I can just, I will pass it on to Mr. Dempsey.
better send it to us in a hurry, right?
Sorry?
You better send it in a hurry. Aren't they meeting tonight about it? Either way.
They're meeting tonight. The select board is the big decision makers. They're meeting tomorrow. Yeah, I'm gonna write it and send it right away. If you could all get back to me right away, that would be great.
Okay, good.
Okay?
Okay,
Yeah. Thank you, Tony.
All right, Dr. J, I just want to double check. The sense of the meeting is clear. So the fact that I'm going to circulate something in writing after the meeting, is that a problem for you?
That's not a problem.
Okay, all right. Thank you all very much.
Are you calling it? Is that it? Or not?
All
okay, we're
right,
done.
I think we're adjourned unless anyone has,
Okay.
I just double, any other
We
business?
had 3 items on the agenda that we never discussed. That was our actual agenda tonight.
Yes, I'd like to hear them, actually. If we have the time, do we?
All right, yes, please go ahead.
I want to hear that.
One of them was an update on the mitigation plan.
Yeah,
So,
thank you.
you know, we still need to discuss, we didn't do the presentation. And I can't really show you the screen, but I was going to show today was that we at now 119 cases.
119, Swanee, or 190?
119. I would give more update. Because you can't see this, but let me send this in the email so you can see it as I flip through it.
And still no deaths?
Yeah, we have 1 death.
1 death, no.
Swanee, while you're at it, the big argument we were having, or big discussion we were having, quarantine or not in senior facilities, is that progressed? Is there more discussion of it?
Well, it's going to come up, so I want to talk a little bit about that because, like I said, this is going to be our issue to deal with. I just sent the PowerPoint to everyone. And I'm going to just walk through the last slides briefly. So right now we have 119 cases, 188 individuals quarantined. And so we created a new column of 23 suspected, presumptive, and the reason being is because a lot of people are not being tested by the doctor, but they fit the clinical definition. So that'll give you a glimpse that we at least, I know, have about 150 cases that we know of, whether tested or not. So every 7 days, it appears our numbers are doubling. So on the 4th of April, we were at 57. On the 10th, we were at 105. Today is the 13th, we're at 119. Now, one of the graphs you will see, if we did no public health measures, on April the 10th, we would have been at 1,024 cases. April the 13th would have been at 2,048. So we have managed to keep it down. But what I'm noticing now is just over the weekend and today, we're probably going to end up adding about 20 cases. So what that is saying to me is people are moving around. So my last slide.
Moving around town to town or within the town?
within the town. So right now I have CVS that has a lot of positive, workers have a lot of positive cases. I have Whole Foods. They now have 3 or 4 positive cases. CVS on Hammond Street. Right now we're investigating. It's a possibility they have, at least 4 that we know of leadership. We also have Wingate now has a significant amount of cases. Care One nursing home. And we're working with Goddard House. They just recently now have a few cases now. And Specialized Housing has 1. So I have coordinated and worked with the state on this in terms of identifying support, PPE, more testing done at the sites. But the numbers is starting to rise in some of these communities. So we're monitoring it closely. But that conversation against, quarantine versus quarantine the building versus quarantine the town, that's becoming real every day. As I see these nursing homes, the cases get mounted. We're doing a second round of testing from the National Guard in Care One. And so I always ask the question because in our mitigation plan, we have 250 cases as a measure to begin to take more restrictive actions, which on today's call, we have expanded some restrictions. So we need to at least begin to have that conversation on what do we do as the cases begin to mount?
In a given facility.
In a given facility or just in these essential places where people are visiting. Because the cases are starting to increase. We have required people to wear masks in places that are essential to remain open. But also part of the mitigation plan that's on our list to discuss is I want to move toward requiring citizens to wear masks in order to visit this place. So move toward everybody in the town wear masks. Because right now we leaving these essential places open. It does us no good to leave them open if they're going to end up being shut down because they don't have the staff to maintain the workers. And we very well might have that case with one of these essential places.
I would definitely do that. Require all the staff of these places to be masked? Well, yes, definitely.
Yeah, but that's already done. The other part is requiring the people that's going to these places to wear masks.
Yes, definitely. You got to hand them out at the door probably because not everybody's going to bring it, but you must wear a mask and have a sign and then have a bunch of masks on the side if they didn't bring their own.
So I lumped them all into one because it is the mitigation plan needs to probably be updated. We need to have a larger discussion on quarantine the building versus a town. And I think mask is probably a no-brainer. So I want to get some thoughts and feedback on that.
For visitors? Is that the question? Or for all staff coming in? Anybody entering the building?
Well, if we're looking at a nursing home, let's say they got 100 cases and they got 100 people in the building, but they got 50 cases. At one point, do we get to look at quarantine? Is it based on the amount of cases or is it based on deaths?
No idea. I don't know. I don't really know what quarantine in this case means. It means you're quarantining those who are sick in one separate quarter, or you're quarantining mean no visitors and nobody comes in and out. What does it mean?
So you quarantine people that have been exposed to the people that are sick.
Isolated are the ones who are sick. Uh-huh.
Yeah.
So there are a few different topics here. Are we taking them one by one, or you want kind of general responses to
general responses?
Of them?
They all tied in.
So do we have a specific kind of mandate or suggestion in Brookline that every resident who is outside is wearing a mask? Is that?
We don't have one right now.
You know?
I'm sorry, are you recommending one? I would be fine with recommending one.
I think we need to go to that.
Yeah, I don't know if that's something we can enforce, but I think we should recommend it for sure.
Oh, definitely.
Well, other communities are enforcing it by a fine. I'm not saying we do that.
First, and then a fine.
But one of the thoughts that has been brought to me is, if we don't, what is our enforcement mechanism? You know, can we issue tickets or citations to people that are not following the rules, such as wearing masks, such as social distancing? Because that is happening in other places.
Are there other,
What's the rule?
other towns around here?
I don't know if, there are some around here, but I know other states definitely is happening.
All right. So are we in any way constrained by the governor's language, right, where it's an advisory, not a mandate? Can we be more
Yes.
exacting than that we can be?
He
What
said
else
that.
can be?
He said it repeatedly that local communities can be more strict than his rules.
Yeah. And will the police be willing and able to do this? I mean,
It
we're
would be-
asking
It would be public health to do that.
Really? Handing out tickets?
I mean, we write tickets for people to they don't remove their snow.
Yeah.
We write citations for housing, for people being
Right.
homeless. We write citations for a variety of reasons.
And you would be
Rocks.
proposing writing, all right. And you would be proposing writing fines for people who are not social distancing or not wearing masks. Is that correct?
Correct.
And what about if it's a family unit? You know, I guess like my wife, my son, and I go out walking together, and we're within 6 feet of each other.
Well, we wouldn't look at a family unit. 'Cause,
Yeah, but then, and so then you have three Boston University roommates who are rooming together, and maybe there's three of them walking together, but then they're joined by a four. I worry about the ability to distinguish sort of dwelling units, you know, that notion of the bubble of expanding your dwelling out into the street. I'm sort of in favor of your notion that we want to strictly want to get people to do this more. I'm just wondering if you can operationalize it in a way that's not going to generate, you know, a negative response. It's going to make it worse.
Well, one, we can require the mask right away.
All right. Is there any?
That's the part that's essential.
Yeah.
You could have signage requiring both right away and make it the state mandate, and then after educational week, come out and with some enforcement and monitoring or whatever.
Yeah. You know, what you could combine with fining for not wearing masks is also giving people advising groups that are not social distancing to do so. I could go either way. If you feel like because I don't think it's going to be abused. I just think it's going to be hard for your staff to make good judgments in real time. But if you feel that you can give them guidance, I have no objection.
Is there capacity in the health department to spend time on this if we're doing fines?
Well, probably right now, I would say, with the amount of cases that seem to creep up every day, no. But I think we do have a couple of people that can assist. So we have to make our rounds anyway to do spot checks on business. Because what I'm finding is some of the people in the business wear masks, some of the people are not wearing masks. even in some of the businesses, the employees are not adhering to the social distancing.
Mhm.
And which, is creating a problem because not only when one employee becomes sick, it tends to knock out 3 to 4 people. So they
Right.
all are quarantined.
Yeah.
And so, this is the constant issue that I'm receiving emails on. Well, I have to go investigate, which usually is me or Pat go investigate, or I go investigate. And somehow we have to curb this. Right now, I'm seeing we didn't really have that many cases, and all of a sudden, our cases are starting to increase at a
Yeah.
substantial rate.
Right.
So to me, that's concerning. We don't have a curve yet, but our number is increasing.
Do businesses currently get fined if they if their employees aren't wearing masks?
No.
Is there a possibility of, prioritizing businesses first instead of just the regular pedestrian?
Yeah.
Yeah, I'm totally on board with that. Again, as you pointed out earlier, contact tracing and quarantine and isolation are the things your staff has to do, number one. But to the extent that you have capacity to monitor the streets and fine, I think getting businesses to required mask wearing inside businesses, fining when it's not happening. I would also move, again, if you have capacity, to mandating individuals wear masks and fine them if they're not. And I guess my third priority, my final one, would be the social distancing, where perhaps for now, we can revisit this next week, but for now we would just say that the job of staff would be to advise people to socially distance.
Yeah.
I mean, you're not going to have the capacity to do the social distancing fines even anyway. So does that feel like it would work for you?
Yeah, that would work for now. I guess the other issue still looms is we're solving the face mask. But at one point, do we quarantine the building?
Yeah.
Have a suggestion on this with experience in it? I don't. You heard you say 50% of the people in the building have.
I just threw out that number. I'm sure threshold probably be something a lot less. But I had one death at this weekend, but I'm anticipating that with the number of cases now that's not in a nursing home, it's probably just a matter of time to begin to look at it from a standpoint of how do we, we have done all we can to try to mitigate, because we can't separate people from the nursing home.
Yeah, but how does quarantining a building, even if it's got a 50% case rate, protect the public? Because you'd want those individuals. Those individuals are all under isolation orders anyway. It just would seem to me that all that happens when you quarantine a building is that you require that the people who are, and then everybody should be, who else in that building who's not sick needs to be tested, quarantined if they've had exposure. But shouldn't that all be done at the individual dwelling level?
So I think, we have a vast entities as of now to go through droplet precautions, order PPE. We have talked, in large about how to do proper household cleaning, how to separate the people that are isolated from the people that are not sick, and to put them on different wings. I've also talked, and I'm still haven't received a response back on one entity that claimed they did the isolation, but they really didn't have any way to cut off the ventilation. Mm-hmm. So now I'm noticing more people are becoming positive. So, that's the other concern, because some of these don't have the HVAC system as you would think. But I think one of the concerns comes to mind is, I've been thinking about this after Revere incident that happened. It was one of the Center for Communities property. Of course, they wanted to quarantine the building here, but they didn't have any cases. But now we have nursing home potentially. But if we have a residential building, nursing home, you could contain it. But if you have a residential building,
Come and go.
people come and go, packages come and go. Do you quarantine the building when you have a third of the people have positive cases? Do you ensure nobody goes in and out so that they don't spread it, to the rest of the community? I mean, to me, I'm looking for some type of measure to say this is feasible direction to move in. You got 1,000 residents, 200 people exposed. That building has to be quarantined. If you got 100 people in the building, 30 people are exposed. You might need to quarantine that building.
Yeah.
And you need to treat the building as if you would do a nursing home or assisted living.
Yeah.
If you have a certain amount of deaths, you need to step up the measures in that nursing home to say, okay, this is what you got to do, and we shutting you out from the rest of the world. We have no capacity to do any step-down units, move people into tents. We don't have that capacity right now because it was never built in.
Yeah.
But these are the critical issues that I'm thinking about and faced with as I see the cases coming.
What about the requisition of a temperature before entering building like they did in China? In Shanghai, where there were not so many cases.
So they're doing temperature checks at a few of the residential places that I went, but I know that's not happening across the board. If it's a nursing facility, nursing home, or assisted living now, they are checking employees when they show up at work because they have to.
What about in the apartment complexes? Is that a possibility, a feasibility, or desirability?
Yeah.
I think it's a good.
I don't know.
And
I think we have to. I think we have to give you our support in taking an action if there's a hot spot as you see fit. I mean, I think that there's too many variables in terms of the layout of a building, the number of people who are sick, how quickly things are rising. So I think you should have the authority to quarantine a building if you have strong reason to know that it will protect the community. Obviously, I think you have to, at the same time, make sure that there's actions taken to protect individuals inside that building, both sick and those who are essentially being functionally quarantined, that they get access to essential services. But the details of how that's going to be are micromanaging that you're going to have to do. And what you probably need is just our endorsement that if and when you think that time has come, we endorse your authority to do so.
Do you feel there's enough of a base, any of you who are more experienced than I am, is to say at a certain number of deaths or cases per population?
I don't know if there's exact measure besides just looking at what kind of strategy to prevent more deaths, or maybe the political pressure behind what happened, like in the veterans home, to jump in and do something. I think, when you start to look at what happens sometimes in, residential housing or as a nursing home, a lodging house, is quickly you find that the people that can assist the employers or the employees at the facility are overrun pretty fast. And they don't have the capacity to respond effectively. Now, Hebrew Life has reached out to me, and they have put in a lot of protocols in place around their existing homes, apartments. But I can't say that that is that has happened across the board, which could pose a problem. I think I can reach out to other senior living facilities, and I'm not for sure about apartment complex. And say at least they need to be checking their employees. And maybe they put some type of measure into checking the people coming in and out the building. So far we've been lucky. There hasn't been any known hotspot coming, from any of these buildings.
Right.
Our cases sort of spread it out pretty much all around Brookline, except for in South Brookline.
All right. In terms of us supporting you right now, if at some point you felt you and your staff had, specific numerical guideposts to go by, I'd be happy to reconvene to vote yay or nay, presumably yay. In the meantime, I think that the most important thing is for you to have a sense that our group would support you, in the event of a hotspot taking necessary action. Is that what you want right now, or is there something else a little more specific?
That's about it.
All right. All right. Does that feel good to everybody?
Yeah, I'd add to that. I'm happy, we're at home, most of us. So I'm happy to, if you decide you need help on whatever decision you want, you need backing on a particular Tuesday at 2 o'clock, go ahead and let us know for that evening. So we don't have to wait every week.
Okay.
Get very busy next several days for you.
Right.
It's fine for me.
Yeah. Right. The problem with us responding on the moment is, again, as a public body, we're obligated.
That's right.
To
48 hours.
Yeah. Right. To get notice, so people have a chance to listen in. So that's a dilemma for us. And obviously, this is an emerging situation, so that's why we have a commissioner. And that's why I think if we give him our, again, the broad backing, and then ultimately but if there is a point where with a few days notice you have something you want us to look at that's more specific, we can certainly do that.
Okay.
And I don't have nothing for next week unless something comes up.
It will.
Well, it will, right. So by the way, I did send this around. Do you want me to read it out loud? I've got some wording here.
Sure.
At our meeting on Monday, April 13th, our council reaffirmed the decision to oppose any expanding of space for use for recreational purposes. On the issue of expanding corridors in areas used by essential workers to get to work or by residents engaged in essential errands, the council was divided and came to no judgment or recommendation, as we do not have the data to know whether such an action will have a greater effect of protecting those engaged in essential services or a greater unintended effect of further encouraging more recreational foot traffic in those areas, particularly over time as people learn of and see these expanded corridors. Therefore, while we do not oppose this action, we strongly recommend that if these expanded corridors are to be continued, that they be closely monitored, and that ongoing observational studies be done to count total traffic now and over time, and as best as can be measured to identify whether these areas are being used for their intended essential purposes or for recreation.
Good. I like it.
Peter likes it.
Fine for me.
President David.
That sounds good to me too. Yep, good for me. Thank you.
Marty, you can say good or you can say live with it.
Well, the thing is, I wanted some measure for them to report back to us, because I still think for us to make decisions moving forward, I do want to see a broader approach in the future, and I would like to see some data on that.
Why don't we specifically call for walkability studies?
Yeah, and I think just like, we sent it to The board, transportation board, I think we need a response back from them in terms of what measures they have put in place, because they thought it was enough need to reach back to us for reconsideration. So I think
Okay,
it's prudent for them to reach back out to us and provide the needed information.
okay, so as the Public Health Advisory Council, we would like your response on how these suggestions for monitoring will be put in place and to see this data on a regular basis.
Yep. I'm fine with that.
Okay. All right, that's our position. We're sticking to it. Can I send this directly to their meeting now?
Yes, I think they are meeting now, and we're due to be on the call.
All right.
Because we're on the agenda at 8:15.
And
Gretchen, did you do the training? Did you do the training for the contact tracing?
Oh, no, I haven't done that.
It was pretty good, actually. Nobody's gotten back to me, but I presume they will.
Well, I don't have a vote, but it sounds good.
Hi, Gloria.
all right.
Good.
All right, so I've added the paragraph about wanting to know how they're going to monitor and that we want the data. And I will send that to Mr. Dempsey. I'll send it all to all of you as well.
Good.
Thank you.
All right.
Guys.
Anything else on the agenda or are we done?
Can I assume we'll meet every Monday at 6:30 unless whatever? Yeah.
Yeah, I mean, we
think
can
I'm
do
looking
that. I think we just need 48 hours notice to put anything on the agenda.
On the agenda.
So that's the
Okay.
key thing, is whatever we discuss has to be on the agenda.
Friday.
Right. Okay. So which means really we should try any agenda item to identify by Friday. That's
think it's by
fair enough.
Thursday.
By
or Monday
Thursday,
meeting.
okay. Yeah,
I
and
could
we
be
can
wrong.
always cancel. And if there's absolutely no agenda, we can always cancel to the following week.
Correct.
Gotcha.
Okay.
Thanks.
All right.
Good job.
Thank you.
So who's going to join the transportation meeting?
Not me.
Not me.
You mean you want somebody from the committee to represent us?
Well, yeah, somebody has to represent ACPH. I'm going to try to have a limited voice so I can still work.
Oh, man.
This is the first I've heard of that, so I did not plan that into my evening.
I can't.
Yeah.
I'm sorry. I have to put my daughter to bed.
You don't think my memo can do the job for us?
They have us on the
Oh,
agenda.
Right.
They sent the request to me and you.
All right.
If I'm correct, they did send it to you, right?
No, I've not gotten anything about it.
Okay. Well, I mean,
I feel like maybe our memo or whatever's written can be a statement. Tony, if you emphasize that in your email when you send it.
Yeah. Okay. You know what I'm going to do? I'm going to send this by email to blank on his first name. I want to say Peter Dempsey because I used to know Peter Dempsey. And I will say that I can be called. I'll give him my phone number, and they can call me and patch me in if they need more than what we send them.
yeah, that's perfectly fine.
Okay.
It's Dempsey.
Yeah.
Thanks for being willing to do that, Tony. You get
Thanks, Tony.
Okay.
extra gold stars.
All right. Are we ready to adjourn?
Yes.
So I have 10 minutes for dinner? Okay.
All right, thank you.
Meeting
you.
adjourned. Okay. Thank you all.
Thank you.